Well, up next, we have a presentation called Optimizing Patient-Centered Inclusive Care in Oncology, Healthcare Professional Knowledge, Attitude, and Practices in Caring for LGBTQ2 plus individuals with Dr. Croke.
Thank you. So thank you very much for giving me the opportunity to present our work today. Nothing to disclose. LGBTQ patients experience cancer-related health disparities and inequities compared to heterosexual and cisgender patients. The literature has shown less satisfaction with cancer care overall due to perceived lack of knowledge from healthcare providers, fear of discrimination and microaggressions, and exclusion of chosen family. In order to address health disparities and reduce barriers to care, we must determine the gaps that currently exist, and these can help inform opportunities for promoting equitable and inclusive patient-centered care. So therefore, our objective was to evaluate healthcare provider knowledge, attitudes, practices, and education interest when caring for LGBTQ individuals with cancer, and to identify opportunities to improve care. We piloted this study in our gynae oncology disease site group. We included all front-facing and non-front-facing staff, so physicians, nurses, but also administrative assistants, clerical clerks, etc. Within our institution. We created a 39-item survey. It included information on demographics, LGBTQ2 plus knowledge, attitudes, practice behaviors, educational interest, and there were several open-ended questions for comments. We actually did a literature review and an environmental scan before to see if there were any questionnaires out there. And then Shabath et al. Has published some work in this area, looking in the US at oncology provider knowledge, attitudes, practices. So we contacted them and got permission and then added some of our own questions to it. That's how the data was analyzed, and we used a modified thematic analysis for open comments because we didn't have oodles of responses. This is just highlighted. Oh, perfect. Okay. So our demographics, there's 92 members of the gynae oncology disease site at Princess Margaret. 75 responded, which was actually great. It was over 80% of our group. The vast majority were either oncologists or nurses. Most were less than 40 years old. Half and half, less than 10 years in practice or greater than 10 years in practice. Most were women or identified as a woman. Most were white, and only 7% identify as part of the community, which I guess is previously on par, but I think that's actually quite lower than probably the average populations. And 2/3 said they do have either family or friends as part of the community, which I also thought was low. But I won't go into all of the results of this slide because it's a bit busy, but under healthcare provider attitudes, we saw some interesting results in that the vast majority strongly agreed to statements about feeling comfortable providing care, but there was significantly less who felt knowledgeable about LGBTQ2 plus specific needs. And the items were separated out for LGBTQ2 plus and transgender care, and significantly less respondents either felt comfortable or knowledgeable caring for transgender patients. And another thing that came out was that the vast majority said it was very important to know one's sexual orientation or gender identity, but significantly less respondents actually said they felt comfortable asking patients these questions. For questions that were about knowledge and practices, so the knowledge questions are actually true, false. They're not subjective at all. You can see the focus of this slide is the amount of gray, and that was respondents saying they weren't sure. So asking about knowledge questions such as lesbian women are not at risk for HPV-associated cervical dysplasia, anal pap testing increases life expectancy. Most respondents just didn't know whether these were true or false. And then our own institutional practices, asking our disease site group, do you know if our institution asks patients about sex at birth, sexual orientation, gender identity? A lot of people didn't know if we asked those questions. And our disease site members weren't sure if we had specific educational resources for patients or specific education for us ourselves. And analyzing the open-ended questions, two themes were very prominent. The first, healthcare providers are concerned about offending LGBTQ2+ patients or individuals. And just one of the quotes, "I don't have reservations in treating the LGBTQ2+ population. However, my lack of knowledge of issues makes me feel worried about not providing best possible care." And then the other theme that came out was that providers really desire LGBTQ2+ specific health training, especially around normalizing asking patients their pronouns, discussing sexual orientation, and caring for transgender patients. So to conclude, although healthcare providers reported feeling comfortable caring for LGBTQ2+ patients with cancer, most did express a lack of knowledge and awareness for this patient population. And as such, we do recommend that institutions implement cultural competency training for all providers, front-facing and non, to enable inclusive patient-centered care. And just some future and ongoing and future work, currently, Princess Margaret has established a sexual and gender diversity in cancer care committee. That's our pictures there. We have a website that you can Google, and I'm happy to share the link. It's a long URL to copy and paste. We've created a resource guide that is somewhat specific to the Toronto, GTA, Ontario area that has local community resources, provincial, national, for our patients. We're on social media at PN Chosen Family, and we have obtained seed grant funding within Princess Margaret to develop our educational materials. And so this grant was development of an educational module to improve communication, engagement, and inclusivity, a curriculum focused on pronouns, gender, sexual orientation, and relationship diversity in cancer care. Thank you.